If I told you I could see the future, would you believe me? Welcome to Practically Social, Episode 5, Future Tripping, dedicated to discussing anxiety. By the end of this video, you should have a good idea what anxiety is and a few therapist-recommended tools to work on reducing it. Hit subscribe and the little bell down there for new drops every week from Practically Social. Alright folks, this week's been very anxiety-provoking with events on the world stage. The unjust invasion of the Ukraine is despicable and heart-wrenching to me personally. Though many of us feel powerless to do anything, I'm sure there's a way we can support the Ukrainians in their independence effort. I've reached out to a few DJs from the eastern countries to see if they would be interested in collaborating for a benefit show. Let's see what happens. I'd love to see some of your ideas in the comments section, especially if you're Ukrainian. My heart is with you. Here we go, future tripping and anxiety. To begin, answer this question. What's the most anxiety-provoking thing in your life? We'll come back to this in a few minutes. Let's define anxiety. Anxiety takes many shapes as defined by the Ep.5, the diagnostic manual that therapists use for mental health disorders. Among them are separation anxiety, phobias, social anxiety, panic disorder, agoraphobia, and generalized anxiety. Let's break two of these down a bit. Anxiety and panic aren't the same. Anxiety is a mental fear response, and panic is a physical response to fear, manifested in your body. Heart palpitations, dizziness, sweaty palms, feeling like you're short on breath are all physical signs of panic. Further on this differentiation, a lot of people have asked me if anxiety is different from fear. I say yes and no. First, I've heard fear described as the emotion felt if a tiger were sitting in the room with us. Anxiety's been described as an emotion tied to the anticipation that a tiger would be sitting in the room with us. This would mean that we have a fear of the fear. So anxiety is anticipatory, whereas fear can be more primal. There is a subtle difference there. Did you catch it? Others have described anxiety as fear that focuses on the future, specifically such as not achieving outcomes that you desire or that you might think you won't match up to, some kind of expectation. Some call this future tripping, which is an accurate way to describe the sometimes obsessive, illogical, and unchallenged thoughts about what will happen to us in the future. More recently, another term's emerged that I place under the anxiety umbrella, even though it isn't diagnosable in the DSM. It's called Imposter Syndrome, and I'll talk about that later. The important thing to remember here is that anxiety can take many forms and is generally future-oriented. If you're future tripping and the thoughts seem to be a little out of hand, this is anxiety. If your body's also experiencing a lot of physical symptoms and you feel powerless to control it, that's likely a panic attack. Now you have a general idea of what anxiety is about. Let's talk about how we determine if you have an anxiety disorder. As therapists, we can tell that you have an anxiety disorder when you discuss worrying most of the day, nearly every day, and worrying which leads to lack of concentration, sleep issues, irritability. Anxiety can also pertain to specific phobias if you're avoiding such things as spiders, heights, or driving. Phobias are all about avoidance. Something else to consider is anxiety and PTSD can intermingle, and they often resemble each other. If you have questions about whether it's one or the other, discuss it with your therapist. As I said before, panic attacks will take a more physical form, and anxiety manifests first in your mind. Panic attacks can be random or related to anxieties or phobias. In many cases, anxiety becomes a problem because it can make people feel obsessive. It can take away from their concentration, lead to irritation, and sometimes even to aggression. I've treated a lot of people over the years seeking anger management. Primarily, their anger problems were related to untreated anxiety. I'd like to think of anger as a magnified fear. This can be a tough concept for some to wrap their head around. I'll be doing a special video in the near future about emotions, and I'll cover that in more detail there. Earlier I mentioned imposter syndrome. This isn't an actual diagnosis. A lot of people have been talking about it. It's a fear that one doesn't measure up, or others will discover they're a fraud of some sort, that they're not as capable or talented as people originally thought they were. There's a lot of personal variations there. It's still future tripping though, see? If you have imposter syndrome, you have future-based anxiety. So some of you are probably wondering, okay, I think I have anxiety. What can I do about it? Anxiety in its multiple forms are disorders that should be diagnosed by a professional, preferably a therapist who can discuss the diagnosis, symptoms, and differences in detail with you. Therapists can give you a more rounded picture of what's going on in your life rather than merely meeting with a doctor or a prescriber for 15 minutes. You'll likely get an hour the first time with your therapist to discuss these kinds of things in detail. So you think you have anxiety? Here's a few pointers. Anxiety is treatable. Generally speaking, we use breathing exercises, coping strategies, and things like thought logs and CBT discussed in therapy. Though the internet is a great place to find resources, working it through with a therapist can help you track your progress and give you some accountability. I've seen a lot of success with my clients when they take this team approach. You're not alone, and if your anxiety feels overwhelming, help is available. A quick note here on medications for anxiety. In the past, several medications were prescribed for anxiety and often didn't include therapy. These included Xanax, Klonopin, or Valium. Modern practitioners have noticed an uptick in dependence and substance use disorders related to these anxiety medications. It's similar to some of the other concerns with opiates. I'm talking specifically here about anxiolytics and benzodiazepines. Many prescribers attempt to get their patients off of these medications, will avoid prescribing them to new patients, and keep very tight tracking on what they do prescribe to their existing patients. So if you're looking for medications to treat anxiety, don't be surprised if the prescriber may or may not take this cautionary approach. They have your health in mind. The conservative reasoning behind this has more to do with the concern of treating one problem, an anxiety disorder, by creating another, a substance use disorder. Usually the best approach is to discuss this with your prescriber and keep your therapist and prescriber in the loop about what medications and methods you're using to address your anxiety. Your therapist will likely want you to start with breathing exercises. They may give you homework to accomplish this, or they might have you practice it with them in the office. Some will suggest different relaxation exercises, calming music, meditation, mindfulness, or a host of other solutions. Give it some time because the stress won't melt away quickly. You have to practice for a few weeks before more pronounced results are achieved. Be patient with yourself and your therapist. Finally, remember that question I asked you about the most anxiety-provoking thing in your life? Can you see the future outcome related to that topic? Take a breath, talk it out, and work toward less anxiety. There you have it, a brief primer on anxiety, what it is, what it feels like, and some ideas for reducing it. Stay tuned for next week's episode on depression. I'm doing these two topics back to back because anxiety and depression can create a vicious cycle for a lot of people. It helps to know what to do if that's your case. Please subscribe, share, and comment, and I'll see you next week on Practically Social.